us an overview of the state of medical facilities at the teaching hospital.
Well, thank you for inviting me. First of all, I think Ghana is a developing country, or we're now moving into middle income status. So that has to be factored into all these discussions. But at the same time, we know that the value of life is the same, whether it's in the first world or in the third world. So wherever you find yourself, the power or the government or whichever authorities have to do their best to provide the optimum health care for its citizens. And I believe that that is a commitment that most of the governments that we've had have had and are committed to. But it's a question of the degree or the extent to which they have been successful in making sure that the health system works in an optimum way and that it produces the most benefit for most of the citizens. That is where the debate now is.
Yeah.
And Ghana, if you look on the world stage, Ghana is not doing too badly in certain respects.
How good is it doing? I mean, if you compare it to the rest of Africa, for example, because it's fair for us to look inward to Africa before thinking
exactly.
about Europe and
when you look at Africa, on the African scene, Ghana is not doing badly because in terms of personnel, we've got one of the top quality personnel that you can find anywhere in the world. That's why, in fact, we've been so successful at training healthcare personnel that it rather works against us in the sense that our doctors always find jobs abroad, or they are sought after.
So seriously, I mean, what I needed to understand is that give me the state of existing medical facilities at Kolebu.
Yes,
is it good or is it bad?
That's what I'm saying, that it's a mixed bag of stages, because you would find centers in Kolebu that are performing at world-class levels. And you also find other areas that are lacking or that, leave a lot to be desired. So the question is to try and bring up those that are not doing so well, and then also to be able to maintain and improve upon those that are doing well. So so it's very difficult to just sort of give a carte blanche or to classify everything as good or everything as bad, because definitely if I say everything is good, you'll find examples that are not so good. And then if you say everything is bad, you also find examples that are good. But then I think overall, I would say that when it comes to elective, that is non-emergency situations, most of our healthcare facilities seem to do relatively well. But then when it comes to emergency situations, like when you have disasters or you have mass casualties, etc., then you find that the system is very strong, or the system cannot seem to cope very well. So that in that sense, there's a lot that we need to do to improve upon our health.
Let me now go on the line. I have Dr. Ajiman Bedu-Akosa on telephone. Good evening, sir, and thanks for joining us tonight on PM Express.
Good evening.
Does it surprise you that this debate has reignited itself again?
Well, I think it's almost like, for some of us, it's like a broken record. I think we've gone through this over and over and over again. I mean, let me start by saying that, it's difficult to compare Ghana's health to the health of other African countries, because that puts Ghana in quite a difficult situation.
Why so? Why so, if I may ask?
No, because I think this country must rate itself much, 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 much higher than most African countries.
Right.
After all, I mean, we've been independent much longer than they have been. And therefore, I think that we should. And, there's so many things that we started a long time ago before any other country started. So, in terms of free education for our people and free health for our people, and therefore you would expect that by this time we should be further away. I think if you want to assess the health status of our community, elective surgery or elective non-emergencies probably will not be the way to start. It's to look at emergencies. You are in a critical situation and you arrive in most of our health facilities, and I tell you, greater than 50% chance you will not survive. Because most of the things that you need to ensure that you survive are not available. Our staffing situation is bad. I've studied that in 1974, there was 1 doctor to 11,000 Ghanaians. Today, in 2012, we have pretty much the same ratio. And yet there are countries who have decided and made a determination. Malaysia in 2010 decided that their ratio was 1 doctor to 1,700 patients.
Now, Professor Acosta...
just let me finish this statement, because it's very important. They made a decision that they wanted the ratio to be 1 doctor to 300 patients. They immediately put in the modalities to train 5,000 doctors. So by 2015, their ratio will be 1 doctor to 300 patients. Why can't we decide that Ghana, at our level, the minimum we should have should be 1 doctor to 5,000 patients, and let's work up to it? Nobody's looking at it that way. As soon as you talk the doctor ratio, it will reflect on the nursing ratio, it will reflect on the ratio with midwives, it will reflect with the ratio with radiographers, with all other health workers. Our staffing situation is so bad, people are burnt out, and yet at the end of the day, you are expected to be in a health facility, ill-equipped, and you're expected to deliver a health service.
This sounds like a very grim situation you're painting for us. I know that you were former director of the Ghana Health Service. Walk us through the levels of investment that you have experienced. I mean, from the time you were at the Ghana Health Service to today, what has been the level of investment in medical infrastructure at our hospitals in the country?
You see, the first thing is, you ask is it the hospitals that we need? That is number one. But let me say that, as soon as I got to Ghana Health Service, one of the first things we did was a zero-based budget. That will give you a critical assessment of how much you need and what you get. And we realized that the Ghana Health Service receives 10% of its needs. 10%. With 10%, there's very little you can do. But let me say that there is an infrastructural building program that is way outside Ghana Health Service. It's almost as if it is the hospitals that indicate that you will have a health service. The Ghana Health Service came out with a community-based health planning and services scheme, and that is putting a community health officer in every community. And we've zoned Ghana into 6,500 communities. To date, almost 10% of these communities have community health officers, because we think we've got to do it piecemeal. But you see, the more you do in terms of this community program, the lesser the number of people who are referred to health centers, to district hospitals, to regional hospitals, and ultimately to teaching hospitals, because it directly moves within the community, it treats people immediately, it also talks about the nutrition of children and women.
So really, Professor Acosta, your prescription for this problem is for us to begin at the level of the community hospitals and move upwards. Is that so?
No, that is a priority, but it does not mean they are not mutually exclusive. It doesn't mean that if there is no anesthetic machine in Kolebu, they shouldn't have one. No, because you have got a facility, a training facility. And if you ask, how often do they even do surgery in Kolebu? It's woefully inadequate, because equipment, and you see, health is expensive. And whether we like it or not, we do not produce any of the machines here. We've got to import these machines. And when the machines are imported, even the maintenance schedule, again, we introduced, preventive maintenance. And yet, machines will be there and they will break down. Once it breaks down, you must have a replacement. And if there's no replacement mechanism, again. So, frankly, the health service, as far as I'm concerned, has been on, should I say, almost getting into a comatose state. And there's something drastic that we have got to do about the health service, right from the community level to the teaching hospital level.
Right, Professor Costa, I'll have you hold on and I'll come back to you. We're still discussing this and we appreciate your time in throwing light on the situation in our hospital. So back to the studio, Dr. Ampoma.
Yes.
Now, to what extent can public officials rely on the health system in our country?
Well, as Prof has said, and I do agree with a lot of the sentiments that he shared. The healthcare system has got various challenges. These are real and these are serious, and I'm sure many of your viewers have been to many of our facilities and, found various deficits, inadequacies, etc. Yeah. And these are issues that should concern all of us. These are issues that we should, as a country, learn not to politicize. Although the politicians play a major role in terms of political will and taking the leadership in making sure that some of these things are done. But it should be discussed dispassionately, because when you get to the hospital, you're not going to, if you have get a heart attack and you're rushed to the hospital, you're not going there as a party person. Whether you belong to this party A or party B will not make a cardiac support system available. So these things might be discussed dispassionately. But back to your question on whether a health system can be relied upon.
Yes.
I think that, like Prof said, we do have quite serious challenges, but then we also have areas of excellence.
So let's start with the challenges. Yeah. Let's outline where the severe challenges are, for example. Is it in treatment of communicable, non-communicable emergency responses? Where are the challenges for the Ghana health system?
Yes, from where I sit as a clinician, although I am a clinician, I think I share the sentiments that Prof shared, in that we do have a higher incidence of certain diseases and certain problems because of lack of preventive strategies which begin at the community level. You take the issue of burns, which is my area of specialty. Many of our burns are occurring because mothers are not, because of our housing problems. So most of the houses are not safe, or because people are working in compound houses where there's no demarcation of play areas from cooking areas. So children are running around unsupervised and they run into these fires, etc. And then because of lack of knowledge, ignorance, you find that people will use all sorts of means to try and give first aid. You have the issue of gas. People are using a lot of domestic gas, but there's no proper education as to how to use gas and some of the petroleum products safely. So people are getting burned by the day. And in fact, if you look at our figures, now about 40% of our admissions are as a result of explosions from these petrochemical products. So that, and these are things that can be prevented, because more than 80% of burns are preventable.
But is it fair to use that as an excuse for not having adequate facilities at the burns unit?
Yes, so what we are saying is that we are not, that's Professor, it's not mutually exclusive.
Right.
But you have to, because if you are not able to put in a proper preventive strategy, then you are going to get the facilities overwhelmed with the numbers of cases that are going to show up. The same thing goes for malaria, environmental sanitation. If you get a cholera outbreaks, no matter how many hospitals are you going to build to take care of some of those things. So there's a role for primary prevention, that's at the community, making sure that people are housed properly, people eat well, the environmental sanitation is taken care of, and then even looking at injuries, the road traffic accident situation. We have a very bad road traffic accident statistic in this country, and that is something that is a preventable situation. So we must look at all those things. But then, even when you've done all the prevention, and your preventive method or prevention campaign is successful, you will still have a number of people who would have to be treated in hospital because people will fall sick, people are growing old, there are all sorts of conditions that arise that must be treated. And so the hospitals also have to be resourced appropriately. Now, what sort of resource do we need? We've talked about manpower, not just for doctors, for all the allied health workers. So you need doctors, you need nurses who are specialized. We have reached a stage where we need to develop various specialties in the other areas. Most of the time we talk about doctors, but then we need the other to develop the other allied health specialties, occupational therapists, speech therapists, all these people all play a role. Nutritionists,
which are not very strong in our health system in Ghana, right?
So they've been more or less neglected, because we focused on certain areas and left others. So, and even among the nurses, for instance, if you go elsewhere in the world, nurses are specializing in various subspecialties so that they can give more advanced care. Because when you have emergency situations or critical situations, you need people with very specialized knowledge to be able to deal with these situations. And of course, there are issue of logistics, because there's not enough to just set up a hospital, but you must give it the logistics to run, so that ordinary things like giving water and electricity. Many of our hospitals, there's poor water supply and things like that. So all these things need to be factored in. And then you also need systems, because you need appropriate management systems, because you can pay the doctors or you can pay the nurses, but if the appropriate systems are not working, the appropriate linkages from the primary level to the tertiary level are not there, so that if a patient is being sent from the primary level to the next center, how is he going to be transported?
So perhaps all these challenges you're telling me are the reasons public officials don't feel they can rely on our health system. Is that so?
Well, I think that if you are, let's say, a public official, I think many of our public officials do visit our health centers,
and many more go abroad for reviews and medical checkups.
Yes, that is, you can look at it one way or the other, right? Because on a practical note, if somebody has a peculiar problem, that's realistically the facilities do not exist in the country to treat that condition. I think it will be unfair, to deny the person the right to go out for treatment. But then all of us should be committed to making sure that we keep developing the health system so that it comes to a point where nobody would need to go out for basic health care.
Right. Thanks for your time with us on PM Express. We have Professor Alex Dodu on the line from the University of Ghana Medical School. Good evening, sir, and thanks for joining us on the line. I think we lost Professor Dodu. You're listening to PM Express. My name is Stephen Enti. Tonight we're discussing the controversial issues that have been raised about the state of our health system. I started by saying that this issue was reignited when the president traveled abroad for a medical review. We have on the line Professor Alex Dodu of the University of Ghana Medical School. Thank you, sir, for making time to join us.
Thank you very much.
We a while ago spoke to Professor Ajiman Bedu-Akosa, who described the state of the health system as in a near comatose. Do you see it that way, or do you agree or disagree?
I do agree with Ajiman Bedu-Akosa. I think the reality of the situation is this. I wonder how many Ghanaians, whether they're health workers or media people or ordinary citizens, have tried to seek emergency care for themselves, members of their family or their friends in the public sector, or indeed in most of the private sector. The reality is that you are left feeling hopeless and very helpless. Because if your child is ill in the middle of the night and it's something like appendicitis, it becomes drama. The drama can be very prolonged. Then most of us are, instead of pretending that this country has the health system able to take the citizenry, we must accept the reality that we are in trouble and that we must do something about it. Anyone listening to this program or watching this program who doesn't get scared about their health in times of acute need should be worried, because really, you can go to the surgical medical emergency in Kolebu now as I speak and see the truth for yourself. A place for maybe 200 people is hosting much, maybe twice, 3 times the number. The air conditioners are not working, the doctors are doing their best, but the facilities are almost certainly historical. You just don't have the facilities to do the job. And as a country, we need to ask ourselves whether the health of our people is important to us, and if it is, whether we are willing to make the necessary investments to ensure that every single Ghanaian, no matter their economic or social standing, gets the care they need when they need it. Healthcare should not be about class or money. It should be about services being available for everyone with respect, with care, with understanding, and being delivered when they need it. If Akota will get care because it's Akota, or Alexander will get care because it's Alexander, what happens if he gets ill in that place where they don't know him?
Now, Professor Dodo, you did mention that we should wake up and accept the reality that we have a big problem. Is it that bad?
It is not just that bad, it is very bad.
And you also did indicate that the problem appears to be that of investment. You think that successive governments have not invested much into the health system?
I think as a country, let me just give you a small example. If today, conditions like appendicitis can strike any time and without warning. If you had appendicitis and you need a surgery now, like in the next 2 hours, God help you, you can get it. If you suffer renal failure now and you need help because your kidneys are packed up and you get help in the next 4 hours, God help you. Look, let's just sort of take away the politics, take away every single big word, and just ask ourselves, are we safe? Can we get the care we need when we need it? If we don't, then there'll be what? Needless death, needless suffering, untold hardships for families. And Ghanaians are very good with big English, but the reality is that we are not doing well.
We have Professor Ajimambedu Akosa back online, Professor Dodo, and so I'll go back to him quickly again. Professor Akosa, good evening.
Good evening.
And thanks for coming back. Professor Dodo agrees with your assertion that the health system is in a state of near comatose. Now, you also did indicate that the health system gets just about 10% of its needs, budgetary needs, actually. What's the way forward? I keep asking this. What really should be the way forward? You've mentioned preventive maintenance, etc. and all, but in terms of investment, what should be the big decisions that we need to take as a country to safeguard ourselves from this trouble Professor Dodo talks about?
I think the first thing is that, things must be coordinated properly. If you look at all the external supports that we give, I tell you, it is fully coordinated. And therefore, you might have communities very close together, getting facilities built, and another one built again. I remember when I was Director General, there was an issue of the European Union having built a clinic somewhere, and that same community had been put on the list for a government of Ghana facility. And however hard we tried, that facility got built, even though the European Union clinic that had been built was having 5 patients a day. You understand? Things are not coordinated properly. But let me say this. We live in a country and we call ourselves middle income. And I've had cause to say that middle income status come with certain indicators.
Some of which includes an efficient health service.
Oh, absolutely. 69% of Ghanaians do not have access to toilets, and you call yourself a middle income country. These are things that distresses me. But you see, as far as our health care delivery is concerned, It has no respect of person. If you get into an emergency and you are the man with, the largest pocket, so long as you are not stable, no flight will take you out of this country. And that is the system that we must fix. We've got specialists, 60% of them are in Accra and Kumasi. But you see, it is important that at least we get some of these well-trained people being posted to district capitals. Even our regional hospitals are not appropriately staffed enough. So every case that comes has to be referred eventually to either Konfanoche and to Kolebu, when most of these things could have been stopped closer to where most of our patients live. So we are not looking at the health sector holistically, and in a system that is ad hocly managed, you will not get the best. And sadly, I listened to the head of plastics, and one of the things that he said is that what we call the wider social determinants of health, which should not be contributors to poor health, are themselves disease causes in this country. And Alex mentioned road traffic accidents. They are themselves causes: environmental sanitation, poor hygiene. All these things, are contributors to ill health. If people drink unsafe water, they would end up in hospital.
Now, Professor Aljuma Bedu Akosa, I'll bounce back to Professor Alex Dodu again, based on the solution you just prescribed, that we need adequate staffing in our health infrastructures and institutions. Professor Dodu, you are from the medical school. In terms of training, would you say we are churning out enough medical professionals to begin filling our hospitals with the necessary manpower we require?
Before I answer your question, I'll say two brief things. One, when you get Professor Aljuma Bedu Akosa and myself on the same network, we will fire non-stop. But coming back to that, we are not training enough doctors for Ghana. With a population of 25 million, we have less than 4,000, and I'm being generous. Practically probably less than 3,000, but let's say less than 4,000 doctors in this country. So the training institutions have to do a lot. But
excuse me, and where does this problem come from? Is it from intakes and admissions to the medical schools, or is it lack of infrastructure to enroll more prospective doctors? What exactly is causing this deficit?
I will give you two phrases. One of them is political will. The politicians don't see health as sexy. And then two, expectations of the public. The media, the public don't see health as important. If President Mills is ill and comes back from the U.S., if Nana Akufo-Addo says whatever or doesn't say whatever, those become the important things. So as a society, it appears that our needs are not on the things which transform our lives. If the media is going to say that, wait a minute, it's unacceptable for a woman to die during childbirth, and anybody who contributes to that is not going to be re-elected, then we begin to shift things. So really, it's about one, what the politicians do, but more importantly, what the public expects. And if we don't shift it, because how much money or how much have our investments in medical training improved? Zilch. Professor Aljuma Bedu Akosa has the Healtg Ghana Foundation, or a name to that effect. How many people have put, but how much has Ghana tried to help someone with clearly the expertise, the exposure, the experience to move Ghana ahead? How many people have gone to see him and say, look, let's make this work? So if it comes back to us, I think most of us need to see health as a national issue, move it away from the partisan politics, and begin to tell ourselves that we are all Ghanaians. For as long as my mother in Jamestown, my brothers in Jamestown, my sisters, wherever they are, will not have the health care that they deserve, Ghana is not right. For as long as you and I are not getting the health care we deserve, Ghana is not right. And look, let's pump it up. Let's pump it up to the level that no matter how broke you are, when you are ill in this country, get cured. Currently, and I will just remind you again, if you don't belong to a certain socioeconomic class and you have kidney problems, you will die. Because it is 100 euros a time for dialysis 3 times a week. So if your family cannot provide 300 euros a week upfront, you will die. It's not you may.
That's a very sad situation, Professor
That's the
Alex
reality.
Dodu.
That is the truth. I mean, you can repeat that again. At least 300 euros a week for dialysis. If you don't have it, it's not covered by any insurance, you will die.
Thank you very much, Professor Alex Dodu. And then I give the final word to you, Professor Agyemang Akosa. Where do we stand? Where do we move from here? What does it look like for us in the future?
I think the first thing is that we should all accept that the health system is broken. But I tell you, it can be fixed. And it is important that we all address that fact that health is no respecter of persons. And that, anybody can fall sick and die today. And as soon as you're dead, your status is irrelevant. And therefore, we should all be introspective and look into making sure that we have a health system that would take care of everybody. And if you do that, and that is the focus, we will get it right. And I agree with Alex that the political will is very, very important. All those who work in the Ministry of Health, who are supposed to be planning the health service, who are probably thinking more about themselves than the health service, it will not help them, and it will not help any of us. The bottom line is that we should accept that the health system needs a lot of fixing, and I said holistically, we can do it. It is not beyond us at all.
Thank you very much, Professor Agyemang Akosa, who is a pathologist and former Director General of the Ghana Health Service. Thank you very much, gentlemen. We also earlier spoke to Professor Alex Dodu, who is at the University of Ghana Medical School. So back into the studio, Dr. Opokuwari Ampoma. These are very grim situations that have been painted for us. Now, from your unit, I use your unit as just one unit in the Korle Bu Teaching Hospital, which also has these problems. Tell me how many patients a day you attend to who come there with, requiring some form of burns, repair, plastic reconstruction, whatever.
Yes, well, it depends. We see both emergency, people come in as emergencies when they've either been injured or been burned, or they've had an accident, road traffic accident, and gotten damage to parts of their body, limbs, tendons, etc., and they need to be fixed. So we see emergencies, and we also see people who are coming in for outpatients.
But you are not able to tell us in numbers exactly how many.
Yes, in terms of the outpatient, we see between 50 to 70 a day.
A day.
And then the emergencies, there are some days we get a lot, some days, minimal.
And these 50 to 70 come from all over the country, or they come from only Accra?
No, they come from all over the country.
And you don't have any other centers anywhere else apart from
there's a unit in Kumasi where there are 4 plastic surgeons, and then there's one plastic surgeon at 37, and then there are 3 in Korle Bu. So in terms of the facilities, the facility in Korle Bu is the biggest in the country in terms of output, etc. And so that's been one of the things that we've been grappling with. And in fact, as part of the 15th anniversary celebration of the Plastic Surgery Center, we undertook some outreach service at Tamale Teaching Hospital, where we saw quite a lot of patients. We did 79 operations in 1 week, and it highlighted the need to have some of these centers or specialists posted to the other districts or regional capitals, as Prof. Akosa was alluding to, and we are in discussion with the ministry to see how best we can help to develop a center in Tamale. But this brings us back to the issue of manpower, because you need the men and the logistics, and of course training is an issue. Fortunately, we have in place the Ghana College of Physicians and Surgeons, which has opened up a lot more avenues for training so that a lot more doctors are getting trained. But still, the numbers are grossly inadequate because we're starting from extreme deficit. So it means we need to double up our efforts if we are going to be able to produce the numbers that will be needed to give adequate service in the country. And
so tell me, before you continue, I just need to assess how important your unit is to healthcare delivery generally in Ghana. So let's take, for example, the explosion which took place near Axim.
Yes.
So how would you say if a burns unit was present at Axim Hospital, would you say that would have helped extremely and perhaps saved some lives?
Yes, definitely. The more facilities you have, and when the facilities are closer to the people, then it means that the potential benefit is greater because then people don't have to travel a long distance to access the care. But generally, burn centers are very expensive, and in fact, in most countries, you don't have burn centers all over. You have it at specific areas, and the more severe cases are transferred. So that's more like a very specialized unit. So you don't have it everywhere. But then you still need a certain minimum number of trained personnel at various levels, both the community, the district, and national level, so that they will be able to adequately assess these patients and give them the basic first aid, resuscitation, and then, if need be, pass them on to the next level. And that is something that is also lacking, and we've been quite concerned about that. We're running training courses for some of the healthcare workers in their districts, because many times when these disasters occur, the initial handling is quite poor, and sometimes that also leads to a poorer outcome for the patient.
You're watching PM Express with me, Stephen Anti, and my guest in the studio, Dr. Opokuware Ampoma. On the line previously, we had Professor Ajiman Bedu Akosa and Professor Alex Dodu from the University of Ghana Medical School. I have a few of your messages. Merlene K. Williams writes that, why do Ghanaian leaders travel outside for treatment? Matthias Entry Bosiako says, welcome home to the president. And DC is saying, Stephen, those new cars and ambulances are the State House. Who do they belong to? Are they for sale or what? People are dying, and when you call an ambulance, someone will tell you the place is too far and they cannot come there. What's all this? Is the welfare of your neighbor no longer important to you? Or what? Oh, God, have mercy. And then Wynne also writes, please, are the medical practitioners in the country not competent or qualified enough that our leaders have to go outside the country for treatment? And another one writes, if the health systems are broken, what are we supposed to do as a country? Or are we going to politicize this one too? Kofi and Kofi says, God save Ghana. And what do we expect? 1,000 patients to one doctor with few medical equipment. Why won't all these happen? Albert A. from Apam writes, for the past so many years, our attention on the health sector is so minimal. Why now? Is it because President Mills's issue? Let's be serious and leave politics out of this. It should be treated non-partisan as that, because if you are healthy and strong, that you can go to work and sustain a life and the economy at large. Alain Olufemi Taniwowo says, that's good for them. They just embezzled all the money from infrastructures. Well, this is a vague allegation. I cannot continue reading. You're welcome to PM Express, and you can still send us more of your messages on facebook.com/multi-TV Ghana. And I want to remind our viewers that we'll be streaming live the IEA presidential debate tomorrow, and featuring will be Dr. Abu Sakara. Dr. Opokuware Ampoma, it does appear that the issue of the president traveling abroad for medical treatment won't go away. I mean, the messages on our Facebook is clear. It has come and it has been discussed here and there. Now, I want to understand from you typically what kinds of medical services or reviews are we unable to conduct here in Ghana that people would need to travel abroad? I'm not limiting this to only the president. What do we lack that will make anyone want to go and seek medical review abroad?
Well, generally, medicine, there are many specialties in medicine, so there are peculiar needs for each specialty. So there are very new technologies that have developed, that's like minimally invasive surgery, etc. And some of these are not readily available in Ghana, although it's started, but it's not expanded to all the specialties. There are also certain complex treatments, even for if you go to in the area of urology, even internal medicine, etc., etc. Even the
we
basic,
don't have those facilities,
which we don't have. So I mean, there's a whole long list of these which cut across all the specialties. So the key is to make sure, try and keep developing, because the healthcare system is not something that you are going to fix one time. And even if today we bring it at par with what pertains elsewhere, if we don't continue investing in it and re-equipping it, come a few years down the road, it's going to deteriorate. And if you look back in time, in the 60s, Ghana was, Ghana had one of the best healthcare systems anywhere.
The best in terms of training or in terms of resources?
In terms of training and resources and advancement. Because if you look at even a place, an area like heart surgery, for instance, Ghana was not too far behind the very advanced countries in developing certain techniques. So that, but because of lack of investment in healthcare, that is why we find ourselves in the current situation. And as my colleagues have said, the political will is necessary, and then we as a country, the people of this country will get the sort of healthcare system that they deserve or that they demand. It's important that we all look at this in a non-partisan way, and people should make sure that we demand the best, because if we accept anything that is mediocre, then that will be our lot. But I think we have to get to the point where we all make it a priority issue, and we should be ready to put in the necessary investment in terms of manpower, infrastructure, the systems, etc. Make sure that we are getting value for money. Because sometimes the problem is not that money is not being invested in the healthcare system, but sometimes you find that an item that costs maybe $20,000, if you were to go to Europe, but when it comes to Ghana, suddenly it is supplied to us at 3 to 4 times the price. And all these are ways in which we are losing. So sometimes it's not that the money has not been spent in the healthcare system, but then we are not getting value for money. Okay. And then we also need to prioritize, what are the most important things that will make the most impact. And because this all need to be coordinated properly. And then in terms of long-term strategic planning for health service delivery, it's also very important. You may be training the specialists, but as Prof said, sometimes you find the specialists are pulling in Accra or in various areas. So we need to find a way of developing the peripheral hospitals and making sure that we post a cohort of doctors, because if you post a surgeon to a district hospital and he doesn't have an anesthetist to work with, then that surgeon goes and finds that he has no work to do because there's no anesthetist to put his patients to sleep. And so that surgeon would find his way back into the city. So you need to have a strategic plan in place so that you know that, okay, look, we are targeting maybe Takoradi and Tamale and these other regions to make sure that within the next 5 to 10 years, we are going to bring the manpower levels up to the levels that are in, let's say, Kolebu and Komfo Anoche. So you can have that sort of strategic plan and work towards it. Make sure that you are training all the general of staff so that they can man these hospitals, man them efficiently, so that by the time that these people have finished their training, the necessary infrastructure and logistics that they need to work is in place for them. And then, then that will result in health. And then the other thing I'd like to say is that sometimes, even the way we even utilize the currently available manpower also leaves a lot to be desired. When I was in the UK, for instance, no specialist stayed in one hospital. Even though you had your main hospital that you worked in, you also serviced several district hospitals.
districts, yeah.
See, so we can look at that, so where even if we have few specialists, we can make resources and logistics available to them so that they can, although you may be at
they can
Kolebu
be
or
well
you can be
coordinated to
and provide
the
the services so that the
necessary
services are
services.
closer to the people, so that people don't have to travel all the way. And then when that happens, the specialists are visiting the district level. They will impart knowledge, skills to the people at the district level, and it brings up the quality of care that people will receive at those levels.
Thank you very much, Dr. Opoku-Ware Ampoma. And before we wrap up, I'll read a few more of your messages. The system is deteriorating. Nothing works in this place. Education is poor, sanitation is distasteful, culture is confused, health is just one of the rots of the society. This is from Amegashi from Sunyani. And then Barbara Nyami in Kumasi says, I understand the president. If he goes to hospital here, details, lies about his health will be all over the newspapers the next day. We spend our money on the wrong things, on judgment debts, and we can't even take care of the health of our people.